study is called SOPHIA. It's a randomized phase 3 pivotal registrational trial comparing a new Fc domain engineered antibody called Margetuximab that binds to the same epitope as does trastuzumab, but it has enhanced immune effector function. In other words, the Fc domain of Margetuximab has been engineered so that it has higher binding affinity for activating Fc gamma receptors on human immune effector cells and lower binding affinity to some of the decoy negative regulatory receptors on those same cells. So it's more potent in eliciting antibody-dependent cell-mediated cytotoxicity, ADCC for short. Trastuzumab can do this, but Margetuximab is like a superhumanized antibody that can do it even more efficiently. The antibody is actually chimeric, so it has a murine antigen specificity domain, but the Fc domain is all human amino acid sequence. So it's a very exciting molecule. It can augment the immune axis, basically, of HER2 antibodies like trastuzumab. So in this pivotal trial, it will go toe-to-toe against trastuzumab in the salvage setting after prior treatment with trastuzumab, pertuzumab, and T-DM1. Both arms in the randomization will receive chemotherapy of physician's choice. So there's a menu of options, for example, capecitabine, gemcitabine, venerelbine, eribulin, and they'll get that in combination either with trastuzumab in the control arm or in combination with Margetuximab in the experimental arm. The primary endpoints are PFS and OS for the primary endpoints, and the secondary endpoints are the usual endpoints for a large registrational phase 3 trial. The key eligibility are the prior treatment, as I mentioned to you previously, and in this trial, brain mets, if they're previously treated and stable, are allowed. So that's not an absolute exclusion criteria. So fairly liberal eligibility and exclusion criteria, and so an important study, and it will test the hypothesis whether you can go one better and beat trastuzumab, at least now starting in the salvage setting. If that's a positive trial, no doubt there will be great interest to move this up further in earlier lines.